Today we will discuss about the drug acting on sympathetic nervous system in the lab session. The objectives of this lab is we will study the effect of sympathetic drugs on isolated heart, effect of sympathetic drugs on isolated intestine, effect of sympathetic drugs on anesthetized animal, and effect of sympathetic drugs on the eye. In the first two objectives, effect of sympathetic drugs on isolated heart and on isolated intestine, we have to isolate the heart and intestine by killing the animal. We have to kill the rabbit to isolate heart and intestine, and we have to test or evaluate the effect of the drugs on heart and intestine. Remaining two objective, the effect of sympathetic drug. Third one, the effect of sympathetic drugs on anesthetized animal. Here we does not need to kill the animal. The animal should be intact. And in fourth objective, effect of sympathetic drugs on the eye. Here also animal is intact. No need to kill the animal. In objective first, effect of sympathetic drugs on the isolated heart of the animal, and generally the rabbits uh, are used to evaluate the effect. In the autonomic innervation and the receptor of heart, you are known that there are two main systems. Two subsystems, sympathetic and the parasympathetic. You can see on the screen in the image there is a preganglionic and the postganglionic receptors. There is sympathetic ganglia and parasympathetic vagals. We already discussed in the lecture about the sympathetic and the parasympathetic innervations. Apparatus for recording the heart contractions. This is the apparatus generally we are used for the recording the heart contraction, which is called rotating chemograph drum. It records the contractions. Here there is in the uh, writing lever which trace it is work like the pen to record the observations. This is the cannula in which we have to put the isolated heart. This is the heart connected to the perfusing cannula, and we have to put the heart, attach the heart to this cannula. See, this is the round. It is, we can say it is a heart, and it is attached to the cannula with the perfusion of the Ringer's solution. Uh, this tracing of the graph indicates some activity, sympathetic effect on isolated heart. This is the baseline. If we see the tracing, the starting tracing is the baseline. We can say it's a normal tracing without any drug. Just there is a Ringer solution perfusion without any drug. If we trace the heart response, it is normal. See, it is a zigzag motion and the normal. After administration of isoprenaline is a beta adrenergic agonist drug which act on the beta 1 and beta 2 receptor in general. Beta 1 receptor available in the heart smooth muscle and beta 2 receptor available in the bronchial smooth muscle. Now, here there is no bronchi. We isolated only heart. So please just think about the heart. Now, no need to think about the beta 2 receptor here. So, if there is a beta 1 receptor, so isoprenaline is the drug which activates the beta 1 adrenergic receptor, increase the heart rate and force of contraction. So isoprenaline is a beta adrenergic drug, and if you see on the tracing, there is increase in the size of tracing as compared to normal one. If you see, this is a normal, and if you see, there is increase, there is an increase in the size. There is, if you see the size of the tracing, it is an significant increased as compared to the normal one. It indicates the isoprenaline activates the beta 1 adrenergic receptor and increases the heart rate and contraction. After some time, when its effect is over, finished, we have to give one washout with the water, and it will give again the normal graph. When it comes to the normal graph, when it will give the baseline, now we have to administer here propranolol. And propranolol, it is the beta receptor, beta blocker, we can say beta blocker. It blocks the non-selective beta blocker. It blocks the beta 1 plus beta 2. So propranolol here, it is a blocker of the beta receptor, and now we are taking the graph of isolated heart. So we have to only think about the heart muscles. So propanolol, it is a beta 1 blocker. It blocks the receptor. Now here, after giving that, the receptor is blocked, and there is same no effect because the receptor is blocked. And it will does not, propanolol does not decrease or increase the heart rate, so just is block the receptor. So here the receptor is blocked. After that, we administered isoprenaline again, which is a beta adrenergic, beta 1 adrenergic agonist. What happened? The isoprenaline, after administration of the propranolol, there is no effect. No effect. How can we see no effect? Because uh, the tracing of the graph is same as before. There is no change, there is no increase and decrease the size of the tracing. It indicates that the isoprenaline, which is a beta 1 adrenergic agonist, does not give any effect after the administration of the propranolol, which is beta 1 adrenergic receptor blocker. It indicates that propranolol blocks the beta 1 receptor, and if we administer the isoprenaline after the blocker, there is no effect. Why no effect? Because propranolol is a competitive antagonist of the beta 1 adrenergic receptor blocker. It already blocked the receptor. So if the receptor is blocked, our drug is not able to react with the beta 1 receptor, and it will not able to activate it. So isoprenaline, as if it is administered without the blocker, it will give increase in the heart rate and the contraction, increase the tracing size. But if it is given, isoprenaline given after the blocker, there is no effect. So same, it indicates that adrenaline or isoprenaline or isoprenolol is a beta 1 and beta 2 adrenoreceptor agonist. And activations of this adrenoreceptor beta 1 increase the heart rate and contractility. Propranolol is a blocker of the beta 1 receptor, and adrenaline or isoprenaline after propranolol, no effect because adrenoreceptor are blocked. Here, suppose instead of isoprenaline, if, okay, we will see the example here, the same tracing, just here, the normal one, normal tracing. After the normal tracing, we administer the drug A, and it causes increase in the tracing size. So we can say it is increase in the heart rate and the contraction. Then after that, after the one water washout, we administer propanolol, and propanolol is a beta agonist, same baseline, no effect. And when we add again drug A, there is no effect. So what is the question? Find out what is drug A. By studying this tracing, you are able to answer what is drug A and why there is no contraction of earth after giving propranolol. Because now drug A, if now think logically, propranolol is a blocker of beta 1 adrenergic because see, we are here studying the tracing of heart muscle, so we have to consider only heart. Propranolol is the blocks the beta 1 receptor in the heart smooth muscle. And if we consider what is a drug A, because drug A initially it causes the increase in the heart rate, the tracing size is increased. So it means that the drug A is beta 1 adrenergic receptor agonist. The drug A is beta 1 adrenergic receptor agonist. Now, which is the beta 1 adrenergic receptor agonist? We have adrenaline, noradrenaline, isoprenaline. If you write the drug is beta 1 adrenergic receptor agonist and the name of drug is adrenaline, noradrenaline, isoprenaline, it is accepted. Why there is no contraction of heart after giving the propranolol? Because the propranolol is a beta blocker, beta 1 adrenergic receptor antagonist, beta 1 adrenergic blocker. It blocks the receptor, and when we give the drug A, our drug A is not able to react with the beta 1 receptor because it is already blocked by the antagonist, that is propranolol. So there is no effect of the drug A. This is the tracing showing the effect of unknown drug on isolated heart of rabbit. Study the curve and answer the following questions. If you see the curve is normal. If you see the curve, the before the baseline, the curve is normal. Then we have to take the baseline. It is very important to see, to differentiate between the normal and response recorded. So it is very important to take the normal baseline. Then here isoprenaline, which is a beta 1 receptor agonist, it is administered, and after the isoprenaline, the drug effect, if you see the tracing is increase, we can say there is increase in the contraction, we can say increase in the contractions of the heart muscle. And here, after this effect, we administered unknown, and we have to find out which is unknown. We administer here unknown, and due to this unknown, what happened? uh, After administration of unknown, we again administered isoprenaline, and but isoprenaline did not give any effect. Isoprenaline did not give any effect. So why this? Now, before before the unknown, without the unknown administration, isoprenaline gives the contraction of heart muscle. So think about adrenaline is beta 1 receptor agonist. It means that the unknown is beta 1 receptor antagonist, or we can say beta 1 receptor blocker. What is unknown now? The unknown may be the beta 1 receptor blocker or beta 1 adrenergic receptor blocker or antagonist. So, which are the examples here? We have the propanolol, which is a non-selective. We have atenolol. We have acebutolol. So, we can see these are the examples which are the specific beta 1 receptor blocker or non-selective, that is propanolol. So, atenolol, acebutolol, propanolol will be the unknown drug. So identify the unknown drug in this tracing. So unknown drug, you can say the unknown drug is beta 1 adrenergic receptor blocker or beta 1 adrenergic receptor antagonist, and examples are propanolol, atenolol, acebutolol, which is beta 1 selective. Justify why the isoprenaline does not produce any effect after the unknown administration. So you can justify because unknown drug is a beta 1 receptor blocker. It competitively blocks the beta 1 receptor, and that's why isoprenaline is does not produce any effect on isolated heart muscle. Second objective, effect of autonomic drugs. See here, autonomic drugs means we can say adrenergic drugs, effect of adrenergic drugs. Huh? Adrenergic drugs on isolated intestine of animal. So this is the innervation, which is generally we seen that the receptors available in the intestine in the lectures. There are two receptors available in the intestine, alpha and beta. This is the tracing. We can say chemograph apparatus to record the intestinal contraction of graph. This is called chemograph drum. And you can see there is a tracing. The lever is recording the tracing. Effect of stimulation of the sympathetic nervous system on the isolated intestine. Inhibition of the motility, and receptors of sympathetic nervous system in the intestines are alpha 1 and beta 2. See this graph, receptor available in the intestine. This is also the isolated rabbit intestine, alpha 1. Now we have to kill the rabbit, we have to remove the intestine, and then we have to evaluate the response of the drug. So there is two receptors available in the intestine, alpha 1 and beta 2. Alpha 1, what is the effect of alpha 1? Generally, it causes the inhibition of motility, relaxation. See, this is the normal tracing. And when we give this drug, agonist, which are this drug? Alpha 1 agonist, epinephrine, which is also called adrenaline, norepinephrine, which is also called noradrenaline, phenylephrine, which is alpha 1 adrenergic receptor agonist. If we administer this drug, what happen? It will cause the inhibition of motility, and inhibition of motility, we can say relaxation. And if you see the tracing is downward. The tracing is downward as compared to normal, as compared to normal. And which is the antagonist for it is available for alpha 1 blocker, the phentolamine, we can say it is the antagonist for the uh, epinephrine, norepinephrine, and the phenylephrine. These three drugs are the alpha 1 adrenergic agonist. They activates the alpha 1 receptor, and the antagonist for this is alpha 1 blocker, and the alpha 1 blocker is phentolamine. From the beta 2 receptor, same epinephrine, adrenaline, and isoprenaline, because noradrenaline does not have the beta 2 activity. So, isoprenaline and the epinephrine have the beta 2 activity. And what is the effect on the intestine? They causes the inhibition of the motility, that is the relaxation. And which is the antagonist for the beta 2 receptor? Yes, we have the non-selective, that is the propranolol. Propranolol, it is a non-selective beta blocker. It will blocks the beta 1 plus beta 2 receptors. Now here intestine, there is no beta 1 receptor, only beta 2 receptor. So this propranolol also blocks the beta 2 receptor in the intestine. Please remember this slide so you are able to answer the questions related to the tracing. Now here, same, uh, the adrenergic alpha and the beta receptors, adrenergic drugs. If we give adrenaline, it will, what is the blockers of adrenaline here is a phentolamine, it is a alpha adrenergic blocker, and the propranolol is a beta adrenergic receptor blocker. Same, if we'll give phenylephrine, which is the alpha 1 adrenergic receptor agonist, and the blocker is phentolamine, which is alpha 1 adrenergic receptor blocker. If we give isoprenaline, which is a beta, now isoprenaline act on the beta 1 and beta 2, but now we are studying the intestine, so remember only beta 2. So it is the beta 2 agonist, and for the blocker we have antagonist. Blocker is propranolol. See the tracing. This is the normal tracing, and if we give after normal, if we administered phenylephrine, and this phenylephrine is a alpha 1 adrenergic receptor agonist. If the phenylephrine is a alpha 1 adrenergic receptor agonist, it will decrease the it will causes the decrease in downward inhibition. We can say inhibition of the motility, and this, if the graph is downward, it indicates the relaxation, or we can say it indicates the inhibition of the motility of intestine. Okay, when it comes to the normal, we administer phentolamine, and phentolamine is a specific, we can say, not specific, but phentolamine, it blocks the alpha 1 receptor. Okay, so now the receptor is blocked, phentolamine blocks the alpha 1 receptor here. After that, if we administer alpha 1 receptor agonist, phenylephrine, it is not able to activate the receptor and not able to initiate the any response on the graph. Why? Because the phentolamine has blocked the alpha 1 receptor. If receptor is blocked, closed, the drug will not activate it. Same it is regarding to the alpha at the alpha 1 adrenergic receptor. What about the beta 2? Because intestine consists of the two receptors. It is activated by two receptor, alpha 1 and beta 2. Now here we will see the example of beta 2. There is an the normal tracing, and after that we administer the isoprenaline, which is the beta 2 agonist, because we are studying here now the intestine, and in intestine there is a beta 2 receptor. What will happen? There is an the, if you see the downward tracing, it indicates the relaxation or inhibition of the motility. Then after that, after the effect is over, if we administer propranolol, which is a beta 2, which is propranolol is a non-selective blocker. It will blocks the beta 1 plus beta 2 receptor. But in the intestine, the available receptor is beta 2. So the beta 2 receptor is blocked here. And after the blockage of the receptor, if we administer isoprenaline again, there is no effect. Why no effect? Because the propranolol has blocked the beta 2 receptor in the intestine. Now, this is a question normal. This is a normal, and we will give the this D, or we can say unknown drug, and this is the tracing, and this is the phentolamine, which is alpha 1 blocker, and this is again the same drug. So what is the question? What is the drug D and its action on intestine? So drug D, now if we see, without any antagonist, without any drug, the D is giving its effect, that is the relaxation or inhibition of the motility. But when we administer alpha 1 blocker phentolamine, it means that this, and after that phentolamine, if we administer again the drug D, there is no effect. So it indicates the if it is blocked, alpha 1 blocker, the phentolamine has blocks the receptor, so it clearly indicates the drug is this drug is alpha 1 adrenergic agonist. And which is the alpha 1 adrenergic agonist? You can say phenylephrine. Yes, phenylephrine is a alpha 1 adrenergic agonist. So unknown drug, or the drug D is phenylephrine. Why there is no intestinal relaxation after giving phentolamine? Because because phentolamine has blocked the alpha 1 receptor, and our drug D is alpha 1 adrenergic receptor agonist, which is not able to activate the alpha 1 receptor because phentolamine has already blocked the receptor. same same tracing, this is a normal. And when we give the M, this is the name, or we can say unknown drug. What happened after giving the unknown drug without any medications? It gives the relaxation, inhibition of the motility. And when we give the propranolol, which is the beta 2 receptor antagonist in the intestine, and after the propranolol, if we administered any drug, there is no effect. So it indicates that the drug is beta 2 adrenergic agonist. So what is the drug M here and its action on intestine? The drug M is here beta 2 adrenergic receptor agonist, and examples we have epinephrine and isoprenaline. Why there is no relaxation or no effects after giving the propranolol? Because propranolol is a beta 2 adrenergic receptor blocker. It blocks the beta 2 receptor in the intestine, and that's why there is no effect of the drug M, or unknown. Same, this is now third objective: effect of drug on the blood pressure of anesthetized animal. Anesthesia means there is a temporary loss of consciousness. We have to uh, give the anesthesia for the temporary loss of consciousness, and we have to study the drug effect. Now, adrenergic receptor in the cardiovascular system. Now, this chart is very important. If you get this chart, you are able to answer the questions related to the experiment. Now, alpha 1 receptor, as we discussed in the lecture, alpha 1 receptor, the locations, it is available in the blood vessels of the skin, mucous membrane, and splanchnic area. What is the effect if there is activation of the alpha 1 receptor? It causes vasoconstriction, and vasoconstriction results in increase in the blood pressure. Vasoconstriction result in increase in the blood pressure. Alpha 2 receptor, as we discussed in the lecture, it is available presynaptic, and it decrease the norepinephrine release. NE means norepinephrine, or we can say noradrenaline. Decrease the norepinephrine release from the nerve ending, and when the norepinephrine release is decreased, what is the effects on the blood pressure? The blood pressure is get decreased. Beta 1 receptor, beta 1 receptor available in the heart, and if it is activated by the agonist drug, there is an increase in the rate and the force of contraction, and its effect is increase in the blood pressure, increase in the blood pressure. Same, beta 2 blood, it is available in the blood vessels of the skeletal muscle, and it causes the vasodilation, and if there is a vasodilation, there is decrease in the blood pressure. So if you are able to memorize or understand this chart, you are able to answer the question related to the experiment. So just remember, alpha 1, beta 1 increases the blood pressure, while alpha 2, beta 2 decreases the blood pressure. Okay. Now see the drugs available. So which are the agonists? Epinephrine or adrenaline, which is the act on the receptor alpha 1, alpha 2, beta 1, beta 2, and effect on the blood pressure is increased. Now epinephrine is a predominant on the alpha 1 and beta 1. That's why the effect of on the blood pressure is increased, because you may say that if it is alpha 1 or beta 1 increase the blood pressure, but alpha 2 beta 2 also decrease the blood pressure. So please keep in mind that epinephrine is dominant on alpha 1 and the beta 1 receptor, that's why increase in the blood pressure. Noradrenaline or norepinephrine, it acts on the alpha 1, alpha 2, and beta 1 receptor. Now here the noradrenaline or norepinephrine dominant on alpha 1 and beta 2 receptor, that's why increase in the blood pressure. Phenylephrine, which is a alpha 1 adrenergic agonist, vasoconstriction, increase in the blood pressure, and isoproterenol, which is also called isoprenaline, which is beta 1, beta 2 activity, but isoprenaline having the effect of isoprenaline is dominant on beta 2 receptor, and that's why there is a decrease in the blood pressure. This is same theoretical information. Systolic blood pressure is controlled by cardiac output and peripheral vascular resistance, but the diastolic blood pressure is only controlled by PVR. PVR means peripheral vascular resistance. If there is a stimulation of beta 1 receptor in the cardiac muscle or heart muscle, it will increase in the cardiac output and systolic blood pressure. If we stimulate the beta 2 stimulation, causes the vasodilation and decrease in the peripheral vascular resistance and decrease in the systolic blood pressure and both diastolic blood pressure. When we activate the alpha 1 adrenergic receptor stimulation, it will cause vasoconstriction. It increase the total peripheral resistance, TPR, total peripheral resistance, and increase both systolic blood pressure and the diastolic blood pressure. This is a tracing. This is a tracing effect of epinephrine, that is adrenaline, on the blood pressure of anesthetized animal. If you see in the tracing, this is the normal one, the starting one, this is the normal one, and there is increase and then decline to normal. So this increase is indicates the increase in the blood pressure. What is the cause of increased blood pressure? Because this adrenaline activates the alpha 1 plus beta 1 receptor, and that's why there is increase in the blood pressure. Mention the adrenergic receptor responsible for increase in the blood pressure. The the receptors available for this epinephrine here is mainly alpha 1 and the beta 1, which is responsive. We can say alpha 1 adrenergic receptor and the beta 1 adrenergic receptor, which are responsible for the increase in blood pressure. And mention the clinical use of above drug. Yes, clinical use, it is generally used in the um, as it causes the increase in the blood pressure, so it is generally used in the situations of the hypotension, with including also some situations of the shock. So this is then the one experiment of the adrenaline. Let us see noradrenaline. What is the effect of noradrenaline? The noradrenaline here also, if you see the norepinephrine and the noradrenaline, it is also causes increase in the blood pressure. If there is a increase in the tracing, see, this is a normal tracing, and there is an increased one, and then came to the sharp decline to the normal. So what is the cause of increased blood pressure here? Because noradrenaline, it is generally mainly act on the alpha 1 adrenergic receptor and the beta 1 adrenergic receptor. So it causes the increase in the blood pressure. And you can explain by the same mechanism how can we increase by the alpha 1 and the beta 2. Beta 1 stimulation causes the increase in the cardiac output and the systolic blood pressure, while alpha 1 stimulation causes the vasoconstriction, increase in the total peripheral resistance, and increase in the both systolic blood pressure and the diastolic blood pressure. Mention the adrenergic receptor responsible for this increase in the blood pressure. The same alpha 1 and the beta 1 adrenergic receptor. Mention the clinical use of above drug. Same, noradrenaline generally used in the indications of the hypotension with some situations of the shock, and we already discussed in the indications of adrenaline and the noradrenaline in the lectures. Phenylephrine, yes, if you see the phenylephrine, same, there is a normal graph, an increase in the tracing contraction, and this increase the graph size indicates there is an the increase in the blood pressure. So what is the cause of increase in the blood pressure here? Here is alpha 1 adrenergic receptor activation leads to the increase in the total peripheral resistance. And mention the adrenergic receptor responsible for increase in the blood pressure is alpha 1 adrenergic receptor. And clinical use, it is generally used for the same condition. Phenylephrine, it causes the vasoconstriction and increase the blood pressure, so it is used in the indications of the hypotension. Isoproterenol. Now here isoproterenol, it is, or isoprenaline, it is act on the beta 1 and the beta 2 receptor. Beta 1 and beta 2. So here if you see the graph carefully, there is increase and then decrease. If you see the graph carefully, there is increase, this response is increased, and then decrease. So what it indicate? Because isoprenaline, what is the first question? What caused the decrease the blood pressure? Now isoprenaline, take in mind of the consideration of the receptors, because isoprenaline is act on beta 1 plus beta 2 receptor. When it act on the beta 1 receptor, it causes the systolic blood pressure increased, see. And when it act on the beta 2 receptor, vasodilation, decrease in the vascular resistance, and decrease in the blood pressure. So it is due to the decrease, the activation of the beta 2 receptor leads to vasodilation, decrease vascular resistance, peripheral vascular resistance, and it causes to decrease the blood pressure. Mention the adrenergic receptor responsible for the decrease in the blood pressure, and the adrenergic receptors available are the beta 1 adrenergic receptor and the beta 2. And clinical use of above drug isoprenaline, it is generally used uh, as a main activity. It is alpha 1, so it is also used in the indications of the hypotension. So this is the same epinephrine effect of the blood pressure or anesthesia animal. Normal one, epinephrine increase the blood pressure. Phentolamine, it will block the alpha 1 receptor. Phentolamine is block the alpha 1 receptor. So it block the um, epinephrine. Adrenaline, it is an activator of the alpha 1, alpha 2, beta 1, beta 2. Now here what happened, if we give the adrenaline or epinephrine, it causes increase in the blood pressure. Okay, when we give phentolamine, it will blocks the now which receptor, alpha 1, then normal one. After that, if we give epinephrine, what happened, the blood pressure is decreased. Why? Because the phentolamine causes the vasodilation. Because why vasodilation? Alpha 1 receptor is blocked. Decrease the blood pressure by blocking the alpha 1 adrenergic receptor. And if we concomitant block the alpha 2, tends to increase in the noradrenaline release, because phentolamine is blocks the alpha 1 plus alpha 2. And if there is, we block the alpha 2, it increase the noradrenaline release and reflex tachycardia and decrease the blood pressure. Same here, the normal tracing, epinephrine adrenaline increase in the blood pressure by activation of the alpha 1 and the beta 1 receptor. Phentolamine, here the phentolamine, it is blocks the specific one. If we see the what is the action of phentolamine, it's very important. That's why I recommend to memorize the chart, the name of the drugs, because the phentolamine, if you see the phentolamine, it is the alpha 1 adrenergic blocker. See here, the phentolamine, it is alpha 1 adrenergic blocker. So if we give phentolamine, as we discussed in this tracing, phentolamine, it is blocked by the phenylephrine, because it is a phentolamine is alpha 1 receptor blocker, just to remind you. So epinephrine, it will activates the alpha 1 and the beta 1 receptor, causes the increase in the blood pressure. If we give the phentolamine will causes the block the alpha 1 receptor. And if we give epinephrine, there is decrease in the blood pressure. Why here now? Because the action of phentolamine, what is the action of phentolamine? Phentolamine is adrenergic blocker, alpha adrenergic blocker. And I think phentolamine is a non-selective, it will blocks the alpha 1 as well as alpha 2. Same like here, same, this is the same, this one is the same. And so that's why no need to explain again and again. So there is no increase in the blood pressure after why there is no increase in the blood pressure for epinephrine after giving phentolamine? Because phentolamine is blocks the alpha 1 receptor. Mention the clinical uses of the epinephrine, same, indications of hypotension and the shock. And the last objective is effect of sympathetic drugs on the eye. Here we must remember that the eye muscles, there is two types of the muscles: circular muscles, which is the sphincter pupillae. The if you see the, this is the black one, the pupil, the first round is a pupil, And after that, the round one is, we can say, circular muscle, or we can say sphincter pupillae muscle, and it is responsible for the, we can, constriction. It is responsible for the constriction. Constriction means there is a decrease in the size of pupil. And second one is a radial muscle. If you see this muscle, last one is radial muscle, we can say dilatory pupillae, dilator pupillae. And here in the dilator pupillae is generally innervated by the alpha adrenergic receptor. Let us see the action. Sympathetic nerves, which is generally innervated by the alpha adrenoreceptor, here same. So this is a pupil, and this one is the dilatory pupillae, we can say pupillary radial muscle, and this one is the circular muscle, inner side. So what is the effect? Which receptor? Alpha 1. Alpha 1 contraction of radial muscle, and which leads to mydriasis. Alpha 1 adrenergic, when we stimulates the alpha 1 adrenergic receptor in the eye, it causes the contraction of radial muscle. Now, which is radial muscle? Please keep in mind, radial muscle. Last one, yes, this one is the last one, is the radial outer one. Outer one is the radial muscle, and when there is a dilation of this radial muscle, we can say contraction of the radial muscle, there is in the mydriasis, contraction of radial muscle. This radial muscle get contracted, this radial muscle get contracted, and the size of the pupil is increased, we can say mydriasis. Okay, so this is the main action. Second action, alpha 2 inhibits the aqueous humor formation and used in the glaucoma. So this is another action, alpha 2 agonist on the eye, but we are studying the effect of meiosis and mydriasis. So remember, if the alpha 2 receptor is get activated, it inhibits the aqueous humor formation, and which is used in the management of the glaucoma. Beta receptor increase the secretion of aqueous humor. Beta blocker treatment of the glaucoma, and is decrease the secretion. If we give generally the beta receptor increases the aqueous humor, and increase in the aqueous humor is not for the glaucoma, so we have to block this. So we'll give the beta blocker, and best example is the timolol. Timolol is block the beta receptor, and it is generally used in treatment of the glaucoma because it decreases the secretion and the intraocular pressure. What is glaucoma? In the glaucoma, there is increase in the intraocular pressure, and we have to decrease the intraocular pressure by giving the beta blocker, and which is the timolol. So effect of phenylephrine on the eye. What is the effect of phenylephrine on the pupils of the eye? So phenylephrine, it is generally innervated by the alpha 1 receptor, and it causes the contraction of the radial muscle. See, alpha 1 contraction of the radial muscle, and it causes the mydriasis. Mydriasis means increase in the size of the pupil. And mention the clinical use of the phenylephrine. So phenylephrine, as we already discussed in the lectures, this is a question for you. Write the pharmacological effects of adrenaline on mentioned organs and mention the name of receptor involved. This is then the organs: isolated intestine, isolated heart, blood pressure of the anesthetized animal, and the eye. So what is the effect of adrenaline on the intestine, heart? You have to write it, and receptor involved. This is the your answer. On isolated intestine, it causes a relaxation, inhibition of the motility, and the receptors are involved are the alpha 1 and the beta 1. On the isolated heart, increase in the heart rate and the contractility, adrenaline, so beta 1 receptor causes these effects, including alpha 1. You can also write alpha 1, no problem. Blood pressure of the anesthetized animal, increase in the blood pressure, alpha 1, beta 1. Yes, yes, sorry, please. In isolated heart, just remember heart, just mention beta 1. Just mention beta 1. And blood pressure of the anesthetized animal, it increase the blood pressure by alpha 1 and the beta 1 adrenaline. uh, and the effect of adrenaline on the eye is mydriasis because it causes the stimulation of the alpha 1 adrenergic receptor. So this is all about the lab sessions. I wish to show you something not mentioned here. Yes, alpha 1 beta 2, alpha 1 beta 2. I wish to correct here alpha 1 and the beta 2. Yes, yes, alpha 1 and beta 2 is right. Yes, no problem. So remember this on the isolated intestine. The effect of adrenaline is relaxation, inhibition of the motility, and the receptor involves are the alpha 1, beta 2. On the isolated heart, increase in the heart rate and the contractility, beta 1. Blood pressure of the anesthetized animal, increase in the blood pressure, alpha 1, beta 1. And on in the eye, mydriasis, that is the alpha 1. I wish to share you something which is not mentioned in the slide about the mydriasis and the meiosis. Here, mydriasis versus meiosis. I wish to show the image actually what is the mydriasis and the meiosis. What happened last time. I also shown in the last lecture. Where is this image? The best one to describe. Yes, let us consider this image. If you are able to see, I will make slightly zoom. Yes, yes. Let us consider this image. Yes. So this is a normal eye. We can say the black one is, we can say pupil. Black one is a pupil. This is a normal pupil, slightly dilated for the moderate light. This is a normal pupil. And if you see here, the black pupil, the size is decreased as compared to normal. This condition is called meiosis. This condition is called meiosis. And if you see this pupil, the black color is very more than the normal one. This is a normal one. And this condition we can say mydriasis, pupil dilated. The pupil size is dilated. So this is the main difference between the mydriasis and the meiosis. This is a normal pupil size. This is a decrease the pupil size. And in medical term, it is called meiosis. And it is an increase in the pupil size. The black color is increased. We can say mydriasis. Mydriasis. So this is about the all of the lab sessions of the drugs acting on sympathetic nervous system. So please read it carefully. If you have any questions, any doubt, any queries, you can feel free to contact me at any time. Shukran. Thank you very much.